Hi, welcome to Therapy Playground. I'm Julieanne.
And I'm Leah.
Today we are going to discuss a bilingual child that Leah currently sees and some difficulties that she's been having with him. Leah, can you please describe this child for us?
All right, so he is a 4-year-old who is bilingual. He was tested in both English and Spanish, both of which revealed a severe expressive receptive language delay. When Dad brought him, he indicated that he wanted therapy to be done in English. He's exposed to English in the daycare. However, at home, Spanish is the primary language that is spoken. Dad says they do speak English at home, but it's more so Spanish. Anywho, so I've been seeing him for about 5 months now, and we're just making minimal progress. I feel like the stuff that I'm sending home, it's not getting carried over, and I'm just having limited success with him.
I think a lot of times with bilingual children it is very difficult because first of all, when you're testing, there are no bilingual tests. You have a English test and another language, in this case Spanish test, and they're based on monolanguage norms. So the child who only speaks one language, it's not based on children who are growing up learning 2 languages. So a lot of times children with bilingualism, they are incorrectly labeled as language delayed. So in this case, I feel that your child is delayed. Obviously, he has a severe delay in English and a severe delay in Spanish, and that shows us that he doesn't have a primary language, that he's equally delayed in both languages. So he is really a monolingual child with no primary language. What are his delays currently? Like, what are you working on as far as goals?
All right, so we're working on identification and the use of different common objects, different types of common foods and things such as that. He also is working towards using 2 or more words in conversation, as well as final consonant deletion, and yeah, that's pretty much it. Now, identifying objects and food, he's pretty much 100% on. He can identify them, he understands, given a binary choice. However, we are just struggling getting him to learn, actually use those words, which in turn is why he's having a difficult time with the 2 or more words. He doesn't have a vocabulary to use. He does better with objects than he does with the food. He is, the food is just the hardest thing because Mom says he has such a limited amount of things that he'll eat to begin with.
Yeah.
So then, I'm trying to teach him foods that he doesn't really eat, but that are very common in the world, and he needs to know how to, use, so he can say, no, I don't want strawberries, or yes, I do want strawberries. Strawberries being the example. It took us 4 weeks straight, twice a week, working on strawberry over and over and over. Like, there were 6 foods that he did know, and strawberry he didn't. So we would review the 6 that he knew, and then I would just introduce strawberry. So what's this? That's a cheeseburger. Okay, what's this? Strawberry. What's this? French fry, cheeseburger. French fries, strawberry. Just back and forth, and so we're just making limited success. So now he knows strawberry, but now we're 4 weeks in and he has 7 things he knows as opposed to all of the others.
And I think it's very difficult for you too because, like you said, the family chose to have services in English, and that is not the language they speak at home. That's a language he's exposed to when he's at preschool, but that's not what he's getting at home. So you can't send home homework because you're sending it home in English. Can the family work on that? No, they can't. And it's kind of unrealistic to say, give this to the daycare and have them work on it. Yeah, that would be great if he was at a daycare. That would, help him identify these objects. But can you really, bank on that they're really going to work on it? I mean, it's worth a shot, but most of the time it's not going to happen. So, I mean, I think you're doing the right thing, isolating one thing at a time. I think that this child is a little delayed. I think that he's a little confused with 2 languages coming in. So he's not sure, what to say in certain situations. And especially, you're right, he's not eating these foods at home. He's probably not eating them in the daycare. I mean, how many times have you gone into a daycare and seen strawberries on a plate?
Right.
I mean, you see pizza, french fries, chicken nuggets, hot dogs. You don't see strawberries and fresh fruits. Yeah, these are things he needs to learn, but what you're teaching him isn't being reinforced at home, and you only see him for 30 minutes twice a week. I mean, a lot of speech therapy is carryover in the home.
Exactly.
And I think you're doing the right thing by isolating that one thing. I bet you he's not going to forget strawberry. He knows strawberry and he's not going to forget it.
Right. So that's our main thing, is that, when I send it home, I talk to Dad, and he's like, Dad says he doesn't even talk in Spanish at home. He only responds in English now, which is what Dad wants. But then our problem is if parents are only speaking in Spanish, and then he has no one to practice that English with except for at daycare, and he's not even at daycare full time. So, anywho, I guess we'll just press on with what we're doing.
With bilingual children, it's very difficult when it comes to what language to work on in speech therapy. According to ASHA, American Speech and Hearing Association, it should be in the child's primary language. And as this child, he was equal in both languages, so the parents chose English. Well, now he can't communicate with his family at home. And these are only some of the difficulties that go on when you're working with, a bilingual child and the family who doesn't speak English. There are so many other difficulties that go on with these families. I hope you enjoyed this podcast. If you need any more information, you can call us at Therapy Playground or at Discovery Playground. Thank you for watching.
Bye.
Bye.